Hi everyone, thank you so much for joining me. My name is Beth Parkes. I've been a registered dental hygienist here in Canada for about 20 years. I gained my clinical experience in general practice, independent dental hygiene, mobile dentistry, orthodontics, and periodontics. With my experience in periodontics, I was given a front row seat to some really great surgeries, including flap debridement. From watching those surgeries, I developed a fascination for really strategic instrument selection and their appropriate use. Today, I want to share with you my systematic approach to instrument selection. We want to make every tray count. One of the biggest questions that we're asked is, how do I fit all the instruments that I want into my tray? How do I anticipate all the anatomical needs of my patient? And again, fit all of those instruments into one tray. So let's talk about a system that's going to make us fully prepared for all the anatomical needs that our patients will present with throughout our day. This image demonstrates my systematic instrument selection approach. You'll notice at the very center of this image is our powerful base tray. From this base tray, we pull in our accessory kits and use them in combination as the needs present themselves. Number 1 is our advanced perio kit. Number 2 is for ledges of tenacious or burnished calculus. Our third accessory kit is for furcation involvement. And the fourth and final accessory kit is for implants. Let's talk about our base tray setup. We want to create a very powerful base tray that will serve the needs of our average patient. When the patient presents themselves and has more anatomical considerations than that base tray can offer us, that's when we reach for our accessory kits and use those in combination with our powerful base tray. For this reason, we want to make sure that we have a very strategic combination of sickles, universal curettes, and area-specific Gracies. Also, we want to make sure that we've selected diagnostic tools that are going to give us heightened tactile sensitivity and those ergonomic benefits that the LM instruments provide. For that reason, I've chosen to include a Flex Explorer. This has a very, very thin and delicate tip, which is going to increase your tactile sensitivity like no other Explorer you've used before. Because it's so fine and delicate, I've decided to add a periodontal probe that gives me a probe on one end, but an additional Explorer if it's needed for a dentist's examination or other reasons that the Flex Explorer is too delicate to achieve. I also want to show you something really unique about the NV1 sickle. We have a nice anterior sickle on the one end, and they've paired that with a really great spoon excavator on the other side. I also want to talk about the Gracies that I've selected. You may be a fan of the Gracie 1112, which is also a great option. I decided to go with a 1516 because I personally prefer its adaptation for the mesial aspect of the molars and premolars. To me, it's similar to the shank of a 1314 combined with the blade of an 1112. And for that reason, I decided to add a 1516 Gracie in place of an 1112, but the choice is yours. The same can be said for a Gracie 1314. For my base tray, I decided to go with a 1314 and reserved the Gracie 1718 for my more advanced perio kit. I want to talk about one of my favorite instruments, which is the NV1. Let's take a look at this one in action. So we see we're using it first as an anterior sickle. It can be used both on the mandibular anteriors as well as the maxillary. And then when I flip it over, it's an excellent choice for the lingual aspect in these little depressions along the lingual where sometimes this really stubborn stain sits. You can use it with a pull stroke to remove that stubborn debris or stain. The same can be true along the maxillary anteriors that are sometimes like little shovels where that stubborn stain that accumulates in the fossa. Let's take a look at our Barnhart 5.6. This is an excellent choice for a universal curette. It's similar to something like a 4L4R, but has a slightly longer terminal shank and a slightly thinner blade. It's great for adaptation in the posterior areas, both for Supragingival and subgingival calculus removal along the broad surfaces, and then can be rolled nicely into the mesial interproximal spaces. You can use this also on your premolars and even for something as delicate and fine as your mandibular anteriors. Just an overall great choice for a universal curette. Let's take a look at our Gracie 1314. This is an excellent Gracie to use in the distal aspect of our molars and our premolars. Let's take a look at the adaptation here. This is a great choice to use for the distals. Slow overlapping strokes and then rolling it into the interproximal space. And the area-specific nature of this is going to help me to enter into all the little concavities and depressions that can be found specifically in the interproximal spaces. Let's move on to our first accessory kit. This kit we're going to reserve for our advanced periodontal cases. We want this to include a thin tissue phenotype, deep grooves, and possibly even recession, and all of the anatomical considerations that we have when we lose some of that alveolar bone and have that anatomy exposed. This accessory kit is going to be really, really helpful for cases like this: complex anatomy, thin tissue phenotype, and recession. We're going to be using this in combination with our base tray. Given the slim profile and the compact nature of the LM cassettes, it's no big deal to have both of these kits on your hygiene tray at the same time. And now we have the benefits of all of our base tray instruments with the advanced benefits of our smaller Gracies in our minis, as well as a couple other carefully selected tools. I've decided to include a McCall 1718, a Sickle NV2, a mini Gracie 1-2, a mini Gracie 1516, and a mini Gracie 1718. All right, I want to take a look at the McCall 1718. This is one of my all-time favorite instruments for the broad surfaces of our molars, especially once we start to have the alveolar bone loss and anatomy exposed. One other point I'd like to make is if we look at endoscopy studies or extraction studies, they find that calculus tends to hide right at the CEJ. So this instrument is fantastic in a toe-down position, right along the broad surfaces, specifically of our molars. It's a really durable instrument that can be helpful with removing even really tenacious calculus. Let's look at the mini Gracie 1516 from our advanced perio cassette. We already demonstrated this instrument in the regular version for our standard cassette. This is going to be the same, but in a mini version. So excellent for those advanced narrow pockets or areas where you want minimal tissue distension or have minimal tissue distension capabilities. You may notice that for the advanced perio kit, I've decided to add in minis. Minis are important for many reasons. A few of them being, they're really helpful for accessing narrow pockets. They minimize tissue distension and trauma. They're ideal for detailed debridement of complex root morphology. They provide enhanced tactile sensitivity. They give us better, more precise adaptation to the contours of the root. And their shorter, thinner blades allow greater control and precision in tight spaces like furcations, interproximal spaces, within concavities and developmental grooves, and especially along distal surfaces. The LM line of instruments come with a fantastic line of stainless steel as well as sharpen free. The option is really up to you which one you choose to use. My only piece of advice that I will stress is when it comes to the mini instruments, I highly recommend going with sharpen free. Those are really small, delicate instruments, and the more we sharpen them, the quicker we're going to wear through them. So if for nothing else, sharpen free for minis is a recommendation of mine. All right, let's move on to our second accessory kit. This kit we're going to reserve for that really tenacious or maybe abundant ledges of calculus, or that burnished calculus that's been there for years. This kit is going to help us with some very, very powerful tools. Maybe you don't need more than one or two of these kits in your practice, but these will be ideal for those patients who come in and you need something with a little more power to it. Let's take a moment and demonstrate this kit. I've decided to include the LM23 sickle Once again, the McCall 1718, a rigid Gracie 1314, a rigid Gracie 1516, and a rigid Gracie 12. By choosing these instruments in a rigid form, we're still going to be having the benefits of the area-specific Gracies, but we're providing more rigidity. The Gracies are excellent choices, but they do offer a certain amount of flex, which is helpful for calculus detection. When it comes to tenacious calculus, we don't necessarily want that flex, but we want the area-specific nature of them with a little bit more durability, which is why I've decided to include them as rigids. Let's move on and discuss our third accessory kit, our furcation involvement kit. This kit we're going to reserve for patients who present with furcation involvement of any grade. I've decided to include a furcation diamond file, a furcation probe, and a furcator. In this kit, I've decided to include a furcation probe. This is going to be really useful for gathering information on the grade of furcation that we have. For grade 1, our furcation probe is just going to enter into the entrance of that furcation. Moving to grade 2, we'll be able to enter into the furcation, but not pass through to the other side. For grade 3, our probe will pass through entirely to the other side, but the area will be covered by soft tissue. Finally, for grade 4, we'll be able to pass through and through, and the area will no longer be covered by soft tissue. To illustrate how important it is to have very, very specific tools in here, I want to show you this image generously donated by Tatiana Brand, who is a registered dental hygienist and a lecturer at the School of Oral Health Care, Faculty of Health and Medical Science at the University of Copenhagen. In this image, we can see how small the working area is at the roof of the furcation, or the fornix. The instrument we select needs to be very, very small and delicate. The average curette measures approximately 0.75 millimeters in width. The working area we have is closer to 0.5 millimeters in this very small space. So we need to be really selective with our instrument to ensure we're able to access these areas and access them with great control. Let's talk about how we would address a furcation area. When we go to use our furcation accessory kit, we're under the assumption that we already have our advanced perio kit in addition. I'm going to start with the mini Gracies out of my advanced perio kit. I'm going to start with my mini Gracie 1718, and I'm going to use it along the distal aspect of the distal root, rolling it into those depressions, and then I'm going to use it along the distal aspect of the mesial root and rolling it into that area of depression as well. Now I'm going to switch over to my mini Gracie 1516, and I'm going to use it along the mesial aspect of the distal root to start, rolling it right into this deep depression along the mesial. And I'm also going to use it on the mesial aspect of the mesial root. In a similar manner, slow overlapping strokes and rolling it right into the depression along the mesial aspect. That leaves me with the broad surface. I have a couple of options. I could use my Gracies, but I'm going to use the McCall 1718 out of my advanced perio kit and use that in a horizontal stroke along the broad surface. Once that's complete, I'm left with the fornix, or the roof of the furcation, to contend with next. As we noticed in the image from Tatiana, we're left with very, very narrow entrances when it comes to furcations. And for that reason, we need to select an instrument that is very delicate and very small. The furcator is the perfect choice when it comes to the roof of a furcation or the fornix of a furcation. I'm going to use it, and I'm going to insert it into this very narrow area and use it almost like a scoop, and scoop out anything that could be left after our instrumentation with our Gracies. Once I've removed everything along the furcation, or the roof of the furcation, there could be small areas of calculus or little remnants of calculus left behind. For that reason, I'm now going to use the furcation diamond file. This instrument needs to be used with very, very light, minimal pressure, almost like you would do with an emery board. And all this is going to do is smooth off any tiny little projections of calculus that could be left over. Being very, very delicate with our usage of this instrument, just smoothing off any little remnants that could be left. And that's how we're going to approach a furcation. We're now going to talk about a more complex combination of our accessory kits. When we have furcation involvement, this is maybe one of the more complex combinations of our kits. We're going to have our hygiene base cassette. We're adding in our advanced perio kit, and now we have the addition of our furcation kit. As you can see, once again, because of the slim profile, they fit together quite nicely. All right, let's review our fourth and final accessory kit. This kit is going to be reserved for our implant cases. In this cassette, I've added in several minis as well as a universal. I recommend having one or two of these kits on hand, but the number that you decide to have will really depend on your demographic. So make adjustments for the number of kits you need based on your own practice. Let's take a moment and walk through the contents of this kit. In the implant cassette, I've decided to include a titanium mini universal, a titanium mini Gracie 1-2, a titanium mini Gracie 11-12, and finally, titanium Gracie 13-14. One of the benefits of these implant instruments is the fact that the tips are interchangeable. If you have the handle and you decide you want a different tip, you can simply remove it and replace it with a tip of your choice. One other thing you could consider, instead of having the full set for your implants, you could consider having one pack that is simply made of the universal. For more complex cases, you may want to consider this full set. I want to thank you so much for choosing to spend this time with me today. I have a few closing comments that I'd like to make about this concept. You may be watching this today and you might think, I like this concept, but you've chosen to use something like a 17-18 and I prefer a 13-14 with my Gracies. That's completely fine. And the same would be true where I have an NV1, perhaps you prefer an SH67. All of these things are completely fine. What I hope you do is take the concept of this systematic approach to instrument selection and interchange the instruments that suit you, suit your needs and your practice demographic. I'm going to leave you with a few parting thoughts and then we'll end our session for today. Use the concept and make your selections. Number 1, have a base tray. Number 2, evaluate your patient. Number 3, bring in accessory kits as needed. Number 4, purchase the number of kits based on your practice demographic. And finally, number 5, have fun and make patient care unique and customized. Thank you so much for joining me today. I've had a lot of fun and I hope that you have as well. I'd love to hear from you. If you have any comments or questions, my contact information is there. Thank you again for your time. Have a great day.